prayer earlier, and so we're going to talk about the treatment options for obesity. And for many, probably more than 100 years, we have known that weight change comes about because of a balance or imbalance between the total energy intake minus the total energy expenditure. So that's calories in, calories out. So if you want to lose some weight and cut out 500 calories a day, you can eat 1,500 calories. And if you burn 2,000 calories, you'll have a 500 calorie deficit. And knowing that there are 3,500 calories in a pound, you would lose a pound a week with a 500-day calorie deficit. And so the question is, how can we impact those various things? The total energy intake comes solely from eating, and that eating is a target for behavior change. Eating can be a target for surgery. Eating could be a target for drugs as well. And then on the energy expenditure, we have activity, and that is a target for behavior change. But then with medication, we can also change the basal energy, the amount of calories that you burn at rest. And then it takes a certain amount of calories to burn food. And medication can affect that to some degree. But you notice that the key here in the middle is eating and activity. And if you want to lose weight, you have to eat less and exercise more. And these are the scientific fixes for obesity: either surgery, behavior change through commercial programs, perhaps books on behavior change, medications, supplements, or exercise. We're going to talk about surgeries first for weight loss. And the weight loss surgery by the scientific community today is considered the best method of achieving long-term weight loss. And I'm sorry that they think that surgery is the best thing. Surgery works in only one of two ways. Surgery either creates a restrictive stomach, so you can't hold very much, or surgery creates malabsorption, so that you don't digest food. And in 1998, there were about 13,000 surgeries for obesity in the United States. By 2011, it was up to 158,000 a year. And in 2018, surgery for obesity is 252,000 surgeries every year. So you can see gluttony and its treatment is really, really big business. Now, these are the most common types of surgery in this order. One is the sleeve surgery, and I'm going to go over each of these in detail, but it's the sleeve surgery that gives you restriction, the Roux-en-Y gastric bypass, which creates malabsorption and restriction. Putting a band around the stomach causes restriction. And then one of the newer ones is called biliopancreatic diversion with duodenal switch. And this is also a restriction and malabsorption type surgery. This is not performed as often. It's very difficult to do, takes a long time to do, and results, as we shall see, in some serious problems. And then there are, these really shouldn't be considered surgeries, but you can put a balloon in somebody's stomach and it'll be full all the time, and they can't eat very much, but there's no cut on them. Now, here is a table that tells you the popular surgeries on the left and how many were performed each year in the recent history, and which ones are popular and which ones are not so popular. So if you look at 2011, you can see that the sleeve surgery was only 17% of surgeries, whereas in 2017, it was up to almost 60%. And the Roux-en-Y gastric bypass has fallen off from 36 down to 17. The band surgery has fallen off from 35% down to 2.7. And this biliopancreatic diversion and duodenal switch surgery has remained about 1% and appears to be a little less popular. And what do you think revision surgery is? Revision surgery are people that are unhappy with their surgery and they want to be put back the way they were. These people are people that get skinny. They don't like being skinny. They like to be able to stuff themselves. They enjoy gluttony more than they enjoy skinny. And so they have their surgery undone and they go back to the way they were. Within the last 6 months, I had a patient who had lost over 100 pounds with her Roux-en-Y gastric bypass, wanted to have it undone. And balloons are becoming a little more popular. About 3% of the procedures are balloon procedures. And so this most popular surgery now is this gastric sleeve. And what they do is they put a row of staples along your stomach and cut away about maybe 3/4 of your stomach and just throw it away. You can never get it back again. Your stomach is reduced to the size of a skinny banana, and it causes restriction. You can't eat very much, and so you lose weight. The problem is you develop some gastritis. Sometimes you have leaking along the staples. Why would you leak along the staples? It's because you eat too much and you stretch that little banana too much and you're popping your buttons is what it amounts to. It results in poor nutrition. The adhesions can happen among intestines. And then if you eat too much, you vomit. And then if you keep eating too much, and one way to do it is drink a lot of Boost or a lot of Ensure and take 6 meals a day, you can put all of those calories back in again. And these people fail to lose weight because they continue to eat too much. Now, here's a lady, and none of these pictures are pictures of patients that I know anything about. But I can tell you that this person had the gastric sleeve procedure, and you can see it worked out pretty well for her, and she's pretty happy with it. Then we come to the Roux-en-Y gastric bypass, and here they take the small intestine, pull it up, and hook it onto a little pouch of your stomach. Almost all of your stomach is isolated from your esophagus, and but the duodenum then dumps into the small bowel, and this creates nutritional deficiencies because all of your iron is absorbed in this duodenum, and now the iron can't go past the duodenum, so you develop iron deficiency. This surgery takes a bit of time to do, costs about $27,000. The gastric sleeve costs about $17,000. So add about $10,000 to it. And this takes quite a bit longer and costs quite a bit. I think for $27,000, I could hire somebody to wrap my wrist with a ruler if I put too much in my mouth, and they could work for me for at least a year. Long-term complications of gastric bypass: you develop iron and calcium deficiencies. So you get an iron deficiency anemia, calcium deficiencies, you get vitamin and protein deficiencies, you develop dumping syndrome. Now, dumping syndrome is about what it sounds like, but what happens here is people eat a meal, and because they don't have the usual digestive tract, it just races right through them. So they eat a meal, have a bowel movement, and everything is just dumped right on. But because it's complicated surgery, strictures are common. Where the various parts were anastomosed, it can narrow down, you can develop obstruction, you can develop internal hernias, and you might have failure to lose weight if you eat too much. Here is a lady that has had gastric bypass surgery, and it looks like it's worked fairly well for her. And here we have the lap band, which is becoming less popular. And here you put a ring around the stomach, create a small pouch, and then you can inflate it or deflate it through this little device that you bring out close to the skin. So you can adjust it a little bit after surgery. And the problem is you have hardware in there, and hardware against your stomach lining can cause an erosion, ulcers to form, and so it wears into your stomach and causes perforation. And it may slip down. If it slips down your stomach, then the pouch is bigger. You can eat more and more. You gain weight. You can get an inflamed stomach lining. You can get an infection of the port where they keep injecting you, if that's what you require. You get scars inside around the plastic thing. And the lap band may just quit working. And you get vomiting if you eat too much. And here is a lady who had lap band, and it worked out fairly well for her, and she was happy with it. Now we come to this very complicated surgery, the biliopancreatic diversion with duodenal switch. This surgery costs between $20,000 and $30,000, depending on whether you have it done here in the United States or in Mexico. There are bariatric places in Mexico that just do these right and left. But what they do here is they do a sleeve procedure. So they take away part of your stomach, and then they take your stomach off of the duodenum and attach it to the distal small bowel. And then they just sew up across the duodenum. They take your gallbladder out. And the reason they take the gallbladder out is so that bile will be constantly secreted rather than stored. And the bile then flows down through the duodenum and the proximal small bowel, and the digestive enzymes from your pancreas do that as well. And then they get dumped in and mixed with the food just about 6 inches before it gets to your colon. So instead of digesting occurring in your stomach and up high, digestion only occurs when food and digestive enzymes mix right close to your colon. And so obviously these people have terrible malnutrition. They can have internal bleeding. Infections are common because it's very close to the colon. Blood clots are common, hernias, and the mortality rate's a little higher. These people also develop an iron deficiency, B12 and folate deficiency. They get osteoporosis due to calcium deficiency. They get A, D, E, and K. Your fat-soluble vitamins are down. And 18%, almost 20%, 1 in 5 will get a protein-calorie malnutrition. Now, here's a guy who had this surgery done, and the surgeon is very proud that he did a good job. And this guy has lost a lot of weight, so he's doing pretty good. When he comes back in a year, he's going to be white as a sheet because he has an iron deficiency anemia. And then you have the balloon, and they used to just put in one gastric balloon, but they have found that it works better if you put in 2 gastric balloons. And they don't blow them up with air. They blow them up with an indicator solution, usually not saline, because that would be a big load, but they load it up with something that's highly pigmented. So if one of these balloons busts, then your stool's going to turn green or yellow or fluorescent or something. So you'll know that something went wrong with your balloon. Now here's a guy who had balloon surgery, but notice his belly still looks a little bit punchy. That's because he's got a couple of balloons in there, but he's obviously lost some weight. And the only reason he's smiling is the cameraman said, smile. And complications of the gastric balloon include nausea, vomiting. Why? Well, you got something big in your stomach. You can have diarrhea, abdominal pain. The balloon can rupture, but it contains indicator solution. So, do these surgeries really work? Well, they do work. And the gastric bypass is the most effective in curing type 2 diabetes, but the surgeons will always tell you that the only way to make this surgery work is for you to improve your eating patterns. And you need to eat less, and you need to keep your physical activity up. So you need to exercise more. And if they had told the patient that before they had surgery, they would have lost weight without surgery, because the calorie balance would have been such that they could have lost weight. And all of the surgeons will tell you that there are complications of a metabolic and nutritional state, and you have to go see the doctor regularly every 3 or 6 months. They have to monitor your vitamin levels, your iron level, and a lot of these micronutrients have to be replaced by IV or by injection because they're not absorbed by mouth. If they were absorbed by mouth, you'd have got it from your food. So you have to use parenteral injections of these micronutrients. Very, very sad. So what are the outcomes of these surgeries? We're going to look at lap band, gastric sleeve, and bypass. And you can see that the surgical mortality is low. Less than 1% of these people die. And early complications are less than 10%, even for the complicated surgeries. Late complications are very high in the lap band. And how many of these people lose their excess weight? And you can see with the lap band, less than half lose their excess weight, only 47%. With a gastric sleeve, less than 50%. With gastric bypass, 62% lose their excess weight. If they have type 2 diabetes, what percent have the diabetes resolve? Well, in lap band, it's less than 50%, gastric sleeve, 66%, and it's 85% in gastric bypass. So for people with a BMI greater than 40, if they're type 2 diabetics, insurance will pay for them to have gastric bypass because it will cure their diabetes and reduce their risk of the diabetic complications. So what about long-term failure? Well, the lap band, the long-term failure is greater than 50%. That may be why it's falling out of favor. And by long-term failure, we mean the failure to lose less than 50% of your extra weight. And so the gastric sleeve, 30% fail to lose their excess weight, and the gastric bypass, only 15% fail to lose their excess weight. So the gastric bypass is clearly the most successful surgery, but you have lifelong nutritional deficits, and about 30% of those people will want to have it reversed at some point in time. So now those are the surgeries that are currently being done. And you might have clients ask you about surgery. So what about commercial diet programs? There are a lot of those. And the most popular ones in July, when I did a little survey online, was Nutrisystem and this new one called Noom, which is moon spelled backwards, Medifast, South Beach, Diet to Go, Bistro MD, Jenny Craig, Fresh and Easy, Hello Fresh, Every Plate, Sunbasket. My son-in-law bought my wife and I Sunbasket for a while. We really enjoyed it. It's expensive. It gets delivered to your door on twice a week. I think we got it on Monday and Thursdays. And very nice food. And after a couple of months, I texted my son-in-law and said, thank you very much, but save your money. But it was an attractive service. And they had vegetarian options, which were good. Everything we got was vegetarian, and we enjoyed it very much. The purple carrot is another new one as well. So what are the costs of these diet programs? And we have the cost per pound loss in the middle column, and on the right-hand column, the cost to lose 20 pounds. So if you use in-the-zone delivery, it'll cost you $5,000 to $6,000 to lose 20 pounds. Jenny Craig, to lose 20 pounds, costs about $2,000. E-diets, freshly prepared, it's going to cost you about $2,000 to lose 20 pounds. That's about $100 a pound, isn't it? And we're getting down to cheaper ones now. Nutrisystem is $300 to $329 for 4 weeks. Each pound will cost you $60. And to lose 20 pounds will cost you about $2,000. And then you got Medifast. To lose 20 pounds, you'd spend $300 to $700 on the Medifast, but then you have to pay for the groceries too. So you have store costs with that. And so these programs are money-making schemes. And so if you're going to have a commercial program, I can tell you that a weight loss program that works, that doesn't cost a lot of money, is going to have global appeal. And I think that's what in health evangelism we need to focus on. But here's the bad news about these commercial diets as opposed to surgery. Research shows that 95% of those who lose weight gain it back within 3 years. And beyond 3 years, the failure rate's even worse. So if you have surgery, it's kind of permanent. But if you drop $2,000 on a commercial weight loss program, in 3 years, you've wasted your money and it's all gone back. And we didn't mention liposuction. Liposuction is a very interesting sculpting. They can suck fat out of any part of your body, and those cells are gone for good. So you're getting rid of fat cells. And if it's done right, when they're all done, you've got a really good shape. And I can tell you that within 1 year, the weight of those people is exactly the same as when they had the liposuction, except they didn't put the fat on where they took it off because those cells are gone. So now you get fat elbows, fat cheeks, you get fat parts of your body that you didn't have fat before. And instead of being sculpted and looking nice, you're looking really lumpy and ugly because you put all of that weight back on places where it didn't used to be before. And so liposuction is to be feared. And then if you want to just go cheap, you can buy a diet book. And these are the top diet books for 2020. These are the most popular ones being sold now. The Healthy Keto Diet and Fill Your Plate and Lose the Weight. That's a nice rhyme, is it? But it's obviously an oxymoron. You can't fill your plate and lose the weight. I mean, of course, if you filled it with hay, I guess you could. But if you're going to fill it with food, it's not going to work. Dressing on the side, another diet myth debunked. The Blue Zone diet. We talked about Blue Zones. The Blue Zone thing has been bought by Advent Health, and I think Dan Buettner still making money off of this book. The pescatarian diet, that's very popular. A lot of Adventists are pescatarians. And then you have the Smart Meal Prep for Beginners. And then Dr. Mark Hyman his stuff is good. He's got good diets. There is really nothing wrong with his stuff. He puts a good book out there, and it's nutritionally accurate. It's very good. Food, what the heck should I eat? And then you have America's Test Kitchen, vegan for everybody, very popular. And of course, Mediterranean diets are always popular. You have the Mediterranean Diet Weight Loss Solution, and you have to kick yourself to get started, it looks like, but it looks good. So drugs for weight loss. Patients will say, I'm going to go to my doctor and I'm going to get a pill. And drugs work at various places. Most of them work in your brain to reduce hunger. Some of them work in your gut to decrease absorption. And some of them increase your metabolism and your energy expenditure. And I consider that to probably be the most dangerous. Here are some common appetite suppressing drugs: phentermine and benzphentermine, Bontril. These are the generic names on the left, the brand names on the right, and they do work. They do help people lose weight a little bit, but they have a lot of side effects. A dry mouth, people are nervous and jittery because it ups your psychic energy. People can't sleep, they feel restless, they're addicted, they're agitated, and they can become addicted to them because these are very often amphetamines or first cousins of amphetamines. And of course, if you have coronary heart disease, you can get chest pain from this, you can get tachycardia, it can make you short of breath, you can get confused, swelling of your feet or ankles if you get some congestive heart failure. So those drugs are relatively dangerous. And now here is an absorption blocking drug, Ally, It's sold as Xenical and Orlistat, and it blocks lipase. And lipase is the digestive enzyme from your pancreas that is responsible for the digestion of fats. And so if you take this product, and it will affect fat digestion, and a third of the fat that you eat will not be digested. It'll go through you. And so if the fat's going through you, it'll give you cramps, gas, and diarrhea, and your stool will be oily, and the oil will float on the water. And its effectiveness, you can lose 5 to 7 pounds in a year. And so you're spending a lot of money. You got to take it with every meal. And but it does work, and it doesn't usually result in a vitamin deficiency of A, D, E, or K, because it does not totally block fat absorption, only a third of it. If you were to totally block it, then you would not digest A, D, E, and K. There's another one that they don't talk about very often, and I don't know that it's prescribed for weight loss very often, but it is a pill that blocks sugars, and it's called acarbose. And acarbose is one of the drugs that diabetics can take, and it blocks the digestion of carbohydrates. It keeps you from breaking down disaccharides into monosaccharides. It'll give you diarrhea as well, but you will lose weight on it. But it's not prescribed for that very often. Here's a drug that actually worked very well and had very few side effects, called Belviq, and I have prescribed this to people and seen some very good results. 47% of people who take that will lose 5% of their body weight in 1 year. Generic name is Lorcasen. It was taken off the market in February of this year because of increased risk of pancreatic, colorectal, and lung cancers. So this pill increased cancer, and for that reason, as soon as that was known, they yanked it off the market. Here is another drug that works actually quite well, and it's a combination of drugs. The one drug is phentermine, which you saw on the very first slide here, which is a little bit like amphetamine. You hear amphetamine and phentermine. They're kind of first cousins. And topiramate is an anti-seizure drug, and it works very well for people that have not grand mal seizures, but minor seizures. It works very well in people with minor seizures. And it's a very useful drug in neurology. And the only problem with it is everybody that takes it loses weight. And so they said, whoa, maybe we should sell this instead of a seizure drug, because we got many more fat people than seizure people. And so let's combine it, and let's use a little bit of phentermine, a little bit of this. And it turns out to be really good. So now the market is not so much for neurological conditions, but it's for weight loss. And notice that 62% of the people lost 5% of their weight in 1 year, which is really good. Side effects: tingling in the hands and feet, trouble sleeping, altered taste, constipation, and dry mouth. And rarely there's an allergic reaction. Rarely there's a memory and mood problem. Rarely there are kidney stones. But I have seen people on this drug lose 50, 60, 70 pounds over the period of a year. And so it is one option to consider. And then there are off-label obesity drugs that are prescription medications that you can only get with a prescription, but they do help people lose weight. And but that's not an FDA-granted indication. One is Wellbutrin, or bupropion, and it's an antidepressant drug. Now, there are some antidepressant drugs that make you gain weight. You take Wellbutrin for depression, your weight will go down some. So there are doctors that use this for weight loss, even though that's not one of its indications. Metformin. Glucophage is used to treat type 2 diabetes. It's the drug you start with for type 2 diabetes. And with almost all diabetic drugs, if you stop them from urinating sugar, they will gain weight. And metformin is one where you give it to people, they tend to lose weight. And so there are doctors that'll prescribe metformin to perfectly healthy people for the purpose of getting them to lose a little weight. And then thyroid medication, obviously thyroid, if you have hyperthyroidism, you lose weight because your thermostat's turned up. You're burning a lot of calories very quickly. And so there are unscrupulous doctors that'll give you high doses of thyroid, make your heart go fast, speed up your metabolism, you're hot all the time, but you lose weight. I consider that to be very unethical. Then there are some doctors that'll say, oh, I think some of this, you're holding on to water. And so they'll give a patient a diuretic. And with a diuretic, you'll lose 5-6 pounds between today and tomorrow. But it's not fat. You're losing water. And water is not a good way, is not fat loss. It's water loss. And so I think that's an unscrupulous use of diuretics as well. And then there are all kinds of over-the-counter supplements you can get that are for obesity. Chitosan, it's a kind of sugar from the shells of crabs and shrimps. People don't lose weight on that. Chromium picolinate, people don't lose weight on that. Conjugated linoleic acid doesn't work. Glucomannan is a fiber that expands in your stomach. And so this is kind of like eating something that becomes a balloon in your stomach. So if you ate a lot of that, it would be like eating these styrofoam peanuts, packing peanuts, and it expands. I mean, it would fill up your stomach and then you wouldn't be able to eat as much. And so I suppose that would help some, and it's probably cheaper than having a balloon put in your stomach. Green tea extract doesn't work. And green coffee extract, that was really big with this neurosurgeon on TV. What's his name? He really promoted this stuff for a while. Green coffee beans, green coffee extract. And it's due to caffeine. It really hypes you up and you're really nervous and jittery. And anyway, some other supplements are eating a lot of guar gum, eat a lot of fiber. Hoodia, it's not safe. Ephedra, people lost weight on ephedra, but ephedra sounds like ephedrine, which sounds like adrenaline, epinephrine. And a lot of people died on that, and the FDA finally stepped in and took it off the market. Then there's bitter orange that people say will help you lose weight. It's very unsafe. So none of these supplements that I've mentioned have been tested for safety or efficacy, or they have been shown to be ineffective. And so none of them really work. So the limits of human efforts, you can either have surgery that mutilates the body, diets that are not the way you really want to eat, or exercise takes way too much effort, and indulgence is more satisfying. It's just easier to be a glutton. And now we're going to talk about exercise and weight loss. And exercise for losing weight is kind of hard, but it's important to exercise if you're trying to lose weight. And I recommend walking, as you know, but swimming, cycling, elliptical trainer, running, jogging, interval training, cross-country skiing, it's all good stuff. But here's how much you have to exercise in order to get rid of something. So if you ate a Mr. Good bar that has 250 calories, you'd have to walk for 48 minutes to get rid of the candy bar. It doesn't take you 48 minutes to eat it. And if you look at ice cream, 1/6 of a quart, 186 calories, takes you 36 minutes. It's just not worth it. Exercise is a hard way to lose weight. Look at a banana split, 594 calories. You'd have to walk for 114 minutes to get rid of a banana split. There are people that would walk 114 minutes to get a banana split. That's a different story. But notice fruits and vegetables here. An apple has 87 calories. In 17 minutes of walking, apple's gone. Need to eat another one. Vegetables, half a cup of green beans, 15 calories, gone in 3 minutes. Half a cup of green peas, gone in 11 minutes. So the truth is, if you changed your diet a little bit and substituted fruits and vegetables for your candy and ice cream, it would be easy to lose weight. And here are other foods. A tablespoon of mayonnaise has 100 calories. You'd have to walk 19 minutes. Just leave the mayonnaise off, okay? Look at a T-bone steak, half pound, 235 calories. 45 minutes. Spaghetti and meat sauce, 396 calories. Have to walk for 76 minutes. And the problem is, after eating spaghetti and meat sauce, nobody walks for 76 minutes. They go to bed and take a nap, or they go to bed. And here is how many calories per hour you can burn off. Your basic metabolic rate is about 65 calories per hour. And so when you're doing nothing, you're burning calories. And if you're sitting up and holding your posture, you can burn 100 calories just sitting doing nothing. But as soon as you start to move, then you're doing extra calories. And if you're walking 2.5 miles an hour, you're burning 210 calories an hour. If you're walking 3.5 miles an hour, you're burning 300. And so I have a little calorie counter. And when I go out and do my morning walk for 30 minutes and walk 1.7 miles and come back, it says that in 30 minutes I burn 200 calories. So I'm proud of that. And here is running at 10 miles an hour, 900 calories. Walking upstairs, 1,000 calories an hour. So, but it's easier just not to eat so much. But we did make this point. Let me make this point. When you eat less, your body sees that you're dwindling, and it calculates ahead, and it sees that in 6.5 years, you're going to disappear. And so your body shifts into a mode of preserving you. And so when you eat less, your body quickly adjusts the thermostat to match what you're eating. And I can tell you, for decades, I put people on a diet, and it would work really great for about 2 weeks, and then it would stop working. And a client would tell me, "Oh, but I'm sticking to my diet." And I always thought that they were lying. But the truth is, they were telling the truth. If you just diet, your basic metabolic rate will adjust itself to match what you're eating, and your diet will quit working. But if you do a little bit of exercise, then your basic metabolic rate doesn't slow down because it knows you're doing this exercise. So if you exercise for 30 minutes, 5 days a week, your body will never slow its metabolic rate. So the best way to lose weight is to eat some less and to exercise some more. And you've got to do that little bit of exercise to keep your metabolic rate up there. So the limits of science, we got a lot of information. We can share that with people, but information doesn't change behavior. We can give people insight as to the root causes of their obesity. That doesn't change behavior. We can give them warnings. You keep this up, you're going to die. They may scare them, but it doesn't change behavior. We can give them food demonstrations and recipes. They might try it, but it may not change behavior. Is there a better way to lose weight? And yes, I have the Best Way program. I didn't get to talk to you about it because of power failure that day, but Best Way is conducted in Seventh-day Adventist churches. Church members provide the human connection with the public. Jesus provides the power to change eating habits, and we teach people to study their Bible. We encourage people to pray. We cover 11 of the 28 fundamental beliefs. Best Way is scientifically sound, and you should have seen the results of it. And the Best Way materials are free. If you can collect some addresses for me and email them to me, I'll send you a USB drive that has all of the files on it, and you can have the Best Way program for free. And we do have a website. It's not best-way.com anymore. It's bestway.us. So without a dash, although this will work too. This will just shift you over to the bestway.us. And then you might want to recommend this to your clients. Jesus was thin, so you could be thin too. Not available in bookstores, but available online from Amazon Books or Barnes and Noble. And we dealt with this question yesterday. Was Jesus thin? Yeah, he walked everywhere. He ate simple foods, grains, barley loaves, and fish. He fasted for 40 days, became emaciated. He shared his meager supplies with the needy. And in Psalms, it says that he counted all of his bones. They look at and stare at me. So he was obviously very, very skinny person. So there you have it. My feeling, just to kind of seal this off, is that with obesity and gluttony being the last chronic disease of civilization, what the church needs more than anything else is a weight management program conducted in churches that's not expensive, so that you're not charging $2,000 to lose 20 pounds, that maybe you can do it for $10 or $20 to cover the cost of your materials that you have to duplicate. And if we can show people that we get close to them, if we show them that Jesus helps them hold on to their new behavior, if we can walk with them when they exercise, the truth is the church, this could change the nation and the world. And no commercial program is going to do it for free. And no church is going to do it with Jesus, because with Jesus, it's salvation by works. And once you're saved, you're always saved. And with God, it doesn't matter if you gain weight or lose weight. But the truth is, it does matter, because a relationship with Jesus helps you maintain your weight and maintain your health. And so once this message is, this is unique to Seventh-day Adventists. The health information is not unique, but how to apply it to your life is unique. And what we need to do is, if somebody wants surgery, we can say, yes, save up your money, and as soon as you got $30,000, go get gastric bypass. And the guy will tell you to eat less and exercise more in order to keep it working. And if you come to us, you don't have to have the surgery. We'll teach you how to eat less and exercise more. And in a year, you can lose weight. I've had people lose 100 pounds on the best way, not during the 10 weeks of the program. They took it twice a year for 2 years, took them 2 years to lose 100 pounds. But during that time, what a transformation. And the person became a really real Christian in the process. I don't know if I mentioned it to this audience or not, but I did have a lady in my practice who lost 40 pounds with God's help. She came in one day and was a little upset, and she said, "There's a problem with this." I said, "Oh, tell me what it is." She said, "Unless I talk to God at breakfast, I overeat at breakfast. Unless I talk to him in the morning, I snack. Unless I talk to him at noon, I overeat at noon. Unless I talk to God all the time, this doesn't work." And I said, "Oh, wow, that's profound." And she was a Baptist lady. I felt like saying, "You just proved it's not once saved, always saved, didn't you?" But I refrained myself, and I said, "Listen, God wants us to have a continuous relationship with him. And you're wanting long-term weight loss. And the two are related." And the lady said, "Oh my." She says, "I'll never complain about having to pray again." Anyway, our time's up. Be back in 10 minutes.